Medical emergencies happen, even in paradise. Here is what to expect in a medical emergency in Puerto Rico, and some tips to help you get through it. This spring has been tough for some of my friends. After several ambulance rides, stitches, broken bones, and unplanned hospital stays, here are some of their best tips to prepare for a medical emergency in Puerto Rico. There are limited bilingual 911 operators, so when you call, don't expect that they'll be bilingual and speak English. Make sure that you have either a Spanish-speaking friend or you have already looked up what to say on your Google Translate. Patients that arrive from an ambulance are treated with a higher priority than walk-ins, but ambulance rides are a little bit different. They're privately owned, and you have to pay cash for your ambulance ride before they take you to the hospital. The cost of the ambulance varies on what kind of insurance you have, but several of my friends have said it ranges anywhere from $125 to $300 for an ambulance ride. Ambulance companies only take cash or ATH Movil, which is a popular app on your smartphone that ties directly to your debit card here in Puerto Rico. Like any hospital stay, bring your own toothbrush and toiletries, especially shampoo and body wash. They will not provide them in Puerto Rico. Bring your own blankets, pillows, and supplies. The hospital is cold and they don't provide any supplies for comfort. Several friends recommend an emergency bag packed with pajamas, slippers, antibacterial wipes, and extra blankets. This is actual video from a country hospital here in Humacao where my friend was in the emergency room. As you can see, there are no sheets, pillows, or blankets. The patient brought her own blanket. The surrounding areas were filthy. We ended up moving her to a hospital in San Juan for diagnosis and treatment. Once we were out of the emergency room and moved into a hospital room, this is what the hospital room looked like. The hospital in San Juan was much cleaner and quieter. Most of the rooms are shared rooms and shared bathrooms. Very simple, sparse bathroom, and fortunately, there was no other patients in this room. The room is basic, simple, and cramped. They do have TVs in the room and charge $10 a day, this size TV, for basic channels. In 5 days, there was never a working monitor in my friend's hospital room. So far, all of the hospitals that I've been to have a paid parking lot, so make sure that you bring cash so you can pay on your way out. They do not accept credit cards. Completing the medical paperwork, it's likely going to be in Spanish. They may not have English translation medical forms, but they will ask for the patient's name, first last name, and second last name. The first last name is your father's name, usually your legal name. This is what I go by. And then the second last name is your mother's maiden name. I don't go by this. It's very common in Puerto Rico to have a second last name, but not everybody does. It can cause confusion with the nurses. They just assume everybody has a second last name. They insist on having your mother's maiden name for the paperwork, and then if it doesn't match your legal name, what's on your medical card, your ID, this can cause a real problem for medical billing purposes and for prescriptions. So make sure that you use your legal name no matter how much they insist on having your mother's maiden name, second name that you've never used in your life. Doctors will speak English, but don't expect the nurses and health technicians to be bilingual. This is very important to have basic Spanish skills. Have a bilingual friend on standby that you can call if things start to get lost in translation. Medical emergencies, it's critical that you're communicating and you understand each other. When a friend was recently in the hospital, a bilingual friend joined us to help with the paperwork and the check-in process and to make sure that things were being clearly communicated upon arrival. Most importantly, be your own advocate. There are not enough nurses and staff, combined with possibly not speaking the same language as your healthcare providers. Things are going to get lost. Updates and regular communications are lacking, especially compared to some of the better hospitals in continental United States. Thank you for watching. I hope you find this information helpful, but you never need to use it.